This learning module was developed by Nipissing University's Best Practice Spotlight Organization team based on the Registered Nurses Association of Ontario's Best Practice Guideline, Assessment and Management of Pressure Injuries for the Interprofessional Team. Nipissing University's BSCM program is undergoing a pre-designation to become a Best Practice Spotlight organization. This project is funded by the RNAO in conjunction with the Ministry of Health and Long-Term Care. This presentation is based on the RNAO Best Practice Guideline, Assessment and Management of Pressure Injuries for the Interprofessional Team. This is just a general guideline for students on how to use best practice guidelines based on your academic year. In first year, it's knowledge of BPG and assessment using BPGs. This is where the introduction of best practice guideline order sets come into play. In second year, it's clinical exposure to application of BPGs. In third year, it's the knowledge and use of BPGs in complex settings. And in fourth and fifth year, it's the application of best practice guidelines in complex scenarios. When reviewing this guideline for application, it should be applied in accordance with the individual with a pressure injury and the organization's needs and practice settings. This guideline provides an overview of supports and appropriate structures in order to provide the best possible evidence-based care. In accordance to the National Pressure Ulcer Advisory Panel, a pressure injury is known as a localized area of skin or underlying soft tissue that is typically over a bony prominence. Presentation can vary from intact skin to an open ulcer and has the potential to be painful. This injury occurs as a result of prolonged and hard pressure or shearing. The factors that can cause soft tissue to be susceptible to pressure injuries can be revolved around perfusion, nutrition, comorbidities, condition of the soft tissue, or microclimate. This diagram goes over the staging of pressure ulcers. It can be found in Appendix E of the Best Practice Guideline. Things to keep in mind about pressure ulcers. Lighter complexions will present with reddened skin, and darker complexions will present with purple-blue skin. Those with poor immune systems may develop pressure injuries in a quick manner. Those who are bedridden or lie in bed for long periods may develop these injuries where their weight is rested, especially on bony prominence including elbows, knees, and tailbone, buttocks, ankles, heels, hips, back of head, or shoulder blades. Those who use a wheelchair for prolonged periods have a higher risk of developing sores on their buttocks. This is a formal video done by Queensland Health that goes over how to prevent pressure injuries. The purpose of this guideline is to outline evidence-based recommendations that apply to both the decisions and best practices of all interprofessional team members who work with the assessment and management of existing pressure ulcers in a population of those 18 years and above. As some evidence may relate to the prevention of ulcers, most of the research considered in this guideline applies to the management of those with existing pressure injuries. Best practice recommendations are provided in 3 areas. Number 1 is practice. This includes all frontline staff and interprofessional staff who provide care to the individual. Number 2 is education. It's those who provide interprofessional and staff education. And number 3 is system, organization, and policy. This can vary depending on the recommendation. It can include administration, managers, government bodies, policymakers, or regulatory bodies. As nursing students, the focus will be on practice recommendations. It is beneficial to be aware of the educational and system, organization, and policy recommendations as well. When reviewing a best practice guideline, it is important to be aware of a gap analysis. This is the difference between current knowledge and practices, what we are doing, and current evidence-based practices, what we should be doing. Gaps can occur in knowledge, skills, or practice. So it is important to reflect on the following questions and be specific. Where is our current practice? Where do we wish we were / where should we be? Why has this gap occurred? And how are we going to close this gap? Performing a gap analysis on best practice guideline is an essential part of reflecting on practice. When reviewing the recommendations, identify where there are gaps in current practice or knowledge and take the time to reflect. When conducting a gap analysis, there are 6 steps. Step number 1 is to perform a needs assessment. Step number 2 is to determine the educational gaps in knowledge, skills, or practice. What is the best practice? Step 3 is to determine purpose of the activity and program objectives and design. Number 4 is course development. 5 is implement the activity. And number 6 is evaluate the activity. First, we are going to look at the practice recommendations associated with the assessment and management of pressure injuries for the interprofessional team. Objective number 1 touches on assessment. 1.1. Conduct a health history, a psychosocial history, and physical exam on initial examination and whenever there is a significant change in the person's medical status. 1.2. Assess the risk for developing additional pressure injuries on initial examination and if there is a significant change in the person's medical status using a valid and reliable pressure injury risk assessment tool. 1.3. Assess the person's pressure injury using the same valid and reliable wound assessment tool on initial examination and whenever there is a significant change in the pressure injury. 1.4. Assess the person's pressure injury for signs and symptoms of infection using a standardized approach on initial examination and at every dressing change. 1.5. Screen all persons with pressure injuries for risk of malnutrition using a valid and reliable screening tool on first examination and if there is a delay in pressure injury healing. Determine the nutritional status of all persons at risk for malnutrition using a valid and reliable assessment tool within 72 hours of initial examination and whenever there is a change in health status or pressure injury. Perform a comprehensive nutrition assessment of all persons with poor nutritional status within 72 hours of initial examination and if there is a change in health status or delayed healing. 1.6. Assess for pressure injury pain on initial examination and continue to monitor pain at subsequent visits, including prior to and after every wound care intervention, using the same valid and reliable tool consistent with the person's cognitive ability. 1.7. Perform a vascular assessment of all persons with pressure injuries in the lower extremities on initial examination. 1.8. Conduct a mobility and support surface assessment on initial examination and whenever there is a significant change in the person's medical condition, weight, equipment, mobility, and or pressure injury healing. Objective 2 is about planning. 2.1. Obtain the referral or consultation required to plan and coordinate a pressure injury plan of care. 2.2. Develop a pressure injury plan of care that incorporates goals mutually agreed upon by the person's circle of care, and the interprofessional team. Objective 3 is about implementation. 3.1. Reposition the person at regular intervals, example every 2 to 4 hours, based on person-centered concerns. While sitting, weight shift the person every 15 minutes. 3.2. Position all persons with a pressure injury on a pressure redistribution support system at all times. 3.3. Implement an individualized nutritional plan of care in collaboration with the person and his or her circle of care that addresses nutritional requirements and provides adequate protein, calories, fluid, and appropriate vitamin and mineral supplementation to promote pressure injury healing. 3.4. Provide local pressure injury care consisting of the following as appropriate: cleansing, moisture balance, infection control, and debridement. 3.5. Provide electrical stimulation as an adjunct to best practice wound care in order to speed healing and provide wound closure in stalled but healable stage 2, 3, and 4 pressure injuries. 3.6. Implement as an alternative the following treatments in order to speed closure of stalled but healable pressure injuries as appropriate and if available: electromagnetic therapy, ultrasound, and ultraviolet light. 3.7. Provide negative pressure wound therapy to people with stage 3 and 4 pressure injuries in exceptional circumstances, including enhancement of quality of life and in accordance with other person and family-centered preferences. 3.8. Collaborate with the person and his or her circle of care to implement a pressure injury self-management plan. 3.9. Implement a person-centered pain management plan using pharmacological and non-pharmacological interventions. Objective 4 looks at evaluation. 4.1. Use the initial risk assessment tool to reassess the person's risk for developing additional pressure injuries on a regular basis and whenever a change in the person's health status occurs. 4.2. Use the initial wound assessment tool to monitor the person's pressure injuries for progress toward person-centered goals on a regular basis and addressing changes. Listed below are the education and system organization and policy recommendations related to the BPG for your reference. Objective 5 looks at education recommendations. 5.1. Develop and implement comprehensive and sustainable interprofessional pressure injury education programs for clinicians and students entering healthcare professions. 5.2. Assess healthcare professionals' knowledge, attitudes, and skills related to the assessment and management of existing pressure injuries before and following educational interventions using an appropriate, reliable, and validated assessment tool. Objective 6. System, organization, and policy recommendations. 6.1. Organizations must lead and provide the resources to integrate pressure injury management best practices into standard and interprofessional clinical practice with continuous evaluation of outcomes. 6.2. Lobby and advocate for investment in pressure injury management as a strategic quality and safety priority in jurisdictions in order to improve health outcomes for people with pressure injuries. This slide outlines some research gaps and future limitations in accordance with this best practice guideline. It is important to collaborate with the individual circle of care to develop goals. This slide outlines pressure injury goals using the acronym SPECIAL.